Good morning, everyone. Have you seen this video? These are Toronto police officers, 1, 2, 3, and they're arresting this guy. I guess he told this officer to go F himself when asked who he was and where he was going, and which is not illegal, right? Carding was removed from being able to be done by Toronto police, and now they're just randomly papers, please, citizens who are just out. And he says, "I told you I'm going here." I'll show you just 30 seconds of this interaction. There's a minute 40. It starts with somebody coming from like the other side of the parking lot. Like, looks like he's coming from the sidewalk, right? He's coming in, he's like, and he does a little bit of video prep. But anyway, I'll just show you this part. Here you go.
Okay. Why are you out right now?
I was going to Bonte. I told him that.
Oh my god!
Can I
Start walking.
Can you let me
walk?
Literally dragging him by the neck.
Walk.
Are you the supervisor, sir?
You're under arrest for obstructing peace officer.
So they arrested him for obstructing a police officer. Very interesting, right? It just, the charges are fluid, right? We'll badger you until you do something enough that now you've broken the law. We told you not to do this, and now you're going to break the law. And my goodness, it's a very concerning situation. There's a lot of people who were yelling at the officers during this interaction. The people holding the cameras are yelling at the officer, saying, "You can't do that, officer. You're not allowed to be handling him like that, blah, blah, blah. You punched him in the face. What are you doing, blah, blah, blah." All that stuff. It's very interesting to watch. So the people who are watching this are very clearly upset. I'll be interested to see how this plays out, right? And who knows what's going to happen? Is this guy going to take legal action? Is this guy going to pay the fine? Is there a fine? Is he actually under arrest? Will he be released on the scene, or did he actually get taken into the station? It's all sorts of very concerning things. Here's Randy Hillier, and he's talking about a thread I went through yesterday. Global Canada, an apparently relatively inactive, lightly staffed nonprofit funded by Bill Gates, is pushing the COVID Zero or Canadian Shield plan, the full lockdown plan, the papers, please, nobody's allowed to leave 5 kilometers of their home area, et cetera, et cetera, et cetera. Very, very concerning stuff. And, well, Randy Hillier's weighing in on it. He says a very important thread that many should read. It begins to answer the question, why did we embrace and continue to impose the communist model to deal with COVID? Because people are pushing for it, and the people who are pushing for it are close to the people sitting at the health table. How do we get rid of the people at the health table? I talked about it yesterday. And, I wanted to mention as well, hold on. Yesterday I referenced, I think I called it Breyer's theorem yesterday. And it's Bray's theorem. And it explains why we're getting so many false positives and why there's so many false positives who are asymptomatic, because they're not sick, because they're false positives, right? You see? And so I think that it's worth mentioning that this is what I was referring to. And I don't like when I get things wrong, but sometimes your memory is like a big board of hooks, and if there's nothing to hang it on, then it falls off easily, right? Like if you just throw it at a wall, it lands on the floor in a pile and it's hard to find. But if you have hooks, so I hung it on the B hook, and I knew it was bays, but I thought it was an Bayers. I don't know why. Anyway, that was the hook I hung it on, and that's why I referenced it wrong. But I wanted you guys to know, here it is, and here's the reference. You can check it out. And that's why I sometimes say the right beginning name, or the right beginning letter, or even the first kind of beginning syllable, and then get the rest wrong, because I've just hung it on that beginning syllable, and that's that. That's not that that's all I need, but that's where I'll look, right? Anyway. Regardless, Norman Spector is moving on. The other day we were talking about Trudeau being in the capital region and working from Rideau College or with his family at the cottage, not Rideau Cottage, the other one, Harrington Lake, and so it's interesting that they're okay with Trudeau moving through the capital region. And this is Norman Spector saying, had we followed the science, then we'd have much less deaths. Australia followed the science and had only 900 deaths. Okay, whatever. But here's a ski hill. This is a picture. This is meant to highlight Trudeau being at work and talking to people, right? He's talking with Cara Freeland and Patty Haydu, and we'll talk about Patty Haydu in a minute, and Dr. Tam and blah, blah, blah. He's working, right? Working hard for you. But they're limiting people's ability to move between Ottawa and Quebec. So if you're the prime minister, you can move between your family home and the home where you work from, I guess, or work and live. I don't know. I don't think he lives at the place where he works. I think like he lives a walk to the place where he works, maybe, and then maybe he goes and visits his family when he's allowed by his wife. Anyway, here's the news article. Ottawa mayor urges skiers to avoid trips to Quebec during COVID-19, to Quebec Hills, right? Don't go skiing. But if you're Justin Trudeau, you can go visit your family. But if you're anybody else, you're not allowed to visit your family across town in Alberta because all those cases. Very scary. Here's John Tory. I'm not gonna have him talk a whole lot here. I'll show the first 30 seconds. It's kind of worth it to understand. Like he lays things out, and he says we're in week 7 of a Toronto lockdown. Like we're going on 2 months of lockdown in Toronto. When did this? And he says, it takes time. Our experience shows from the first pandemic that it takes time for these lockdown measures to take effect. No, clearly the lockdown measures are not working. The case numbers are at unbelievable highs. Why? Oh, maybe either lockdowns don't work or your tests are flawed. Huh? Check out Bayes' theorem. Okay, here's John Tory, just at the beginning.
We are
here.
beginning this new year going into the second week of the province-wide lockdown, with the city itself in the 7th week of further reaching restrictions. It is also the 300th day that our City Emergency Operations Centre has been activated at its highest level to respond to this crisis. While the numbers of new COVID-19 cases continue to be alarmingly high, we know from our experience last year during the first lockdown that it takes time for these measures to have a downward impact on those numbers, beyond whatever they may have contributed to keeping the case count better than it might otherwise have been.
That's the argument. Oh, well, because we did this, it would have been so much worse. Except that that's not true. In BC, they put in the carbon tax, right? But now they've monetized carbon, right? So now there's this whole quasi economy that functions on carbon trade, right? So they're not going to get rid of carbon. No. It's just going to become more expensive. They want you to use carbon because it's money in the bank, man. It's got a value, right? So it's the same bait and switch here, right? Like, oh, well, it would have been so much worse without the carbon tax, right? Good thing we got that carbon tax in there because otherwise it would have been worse. And that's not true because you can look at the United States. They had no carbon tax and they actually reduced their emissions because there's no value in keeping carbon around, right? So you can become more efficient if you want to. But the carbon tax is just a shadow economy that's leeching off of the real economy that you and I can't get into, right? Carbon swaps and carbon credits and trades and all that other stuff. And it's the same bait and switch though. It's the same garbage. It's the same BS. It's using the argument, well, had we not done anything, it would have been so much worse. And again, you can compare BC to Ontario or other municipalities that didn't have the carbon tax, and we actually do better. BC's carbon grew at a faster rate. Wild, right? And I don't think that's every single year. I'm cherry picking data there, but there are years where BC's carbon grew at a faster rate than places without carbon taxes. I'm sure there are years where it slowed down, blah, blah, blah. But my main point is it is muddying the waters when you cherry pick like that. It is muddying the waters when you say would have been so much worse. Would have been so much worse without all of those interventions that we've done. There's no proof of that. Like, it's pretty bad, and it continues to be bad. And the leadership from Tory to provincial, Ford to federal, just continue to ignore any inconvenient facts. Ivermectin, I got it that time. Haha. HCQ, right? All of these things are good therapeutics, which are not vaccines, but they're useful therapeutics that would work and save lives. And so isn't that concerning when they're using it to push their or to continue their failed interventions that don't work? It's very frustrating. Here's Rex Glacier, and he says, vaccine rollout debacle, poor planning and leadership. And each day and week goes by, we run the risk of falling further and further behind. As vaccines sit in freezers and seniors die, Justin Trudeau takes a nice long vacation, except that that's not entirely true, right? This is the Global News saying experts call for quick rollout. But here's Dr. Jacobs Rad, and he blocked me and then unblocked me. I don't know why. Weird. But anyway, he says, there's an army of experts claiming that we're leaving too many doses in freezers. They're either not comfortable with math or not comfortable with science. 50% of doses for a vaccine that requires 2 doses must be left in reserve. Alberta has 0 doses available. So you can't, if you have to give everybody 2 doses and that's what's been tested, you can't roll out all of the doses for the first dose and expect to get enough doses within the required time for the second dose in time, right? Like, they'd be waiting for another Pfizer shipment and say there's a delay. There was a delay in Guelph. People are all upset about it, which I think is funny because, like, the vaccine doesn't stop you from getting the virus. It doesn't stop you from transmitting the virus. There's lots of very interesting things that I just am not sure that people really fully understand. And it's frustrating because the media is not really telling people. But anyway, I think that it's interesting that we've got all these experts who are claiming, we've got to get those vaccines in arms and move faster. But according to this doctor, and he's a doctor, he was saying that, well, we can't do that. We have 0 doses available. We're going to move into England and Wales currently to look at what's going on there. And we'll look at Boris, because Boris is threatening further lockdowns and how they count deaths in England. But first, Wales NHS, National Health System, admitted 47,323 people for flu, pneumonia in 2018-19. So far this year, Wales NHS has only admitted 23,974 patients for COVID, nearly half of normal levels of COVID or flu. Additionally, bed occupancy is below 2018-19 levels. What does this mean? Wales would probably have admitted around 40 to 50,000 patients for flu, pneumonia treatment this year. The COVID data indicates that they have only admitted 49% of that level for COVID this year. Bed occupancy level is normal for 2020 compared to previous years. Based on this data, and more is to follow, it indicates Wales has not had the massive influx, which is why they have shut down their NHS. The decision to shut down Wales is political, not health-based. All patients should consider whether legal action is appropriate for any delays. 95% were dealt with by full admission and 5% in 2018-19 by day case. Please retweet more data coming later today. Follow me for latest. And this is Statistics Guy. He's a UK guy I follow. I think that comparing other countries that are similar to us, and the UK is bigger than us, and I think that their health system is a bit more robust than ours. They cover more. But it's interesting that they're going into full lockdown. This is the same pattern. And like I said, it doesn't seem to matter the numbers. It really doesn't seem to matter the numbers. I'm going to show you Guelph's numbers in just a minute. We are in a full lockdown, 8 days into a full lockdown after Christmas. I cannot imagine what the goal is. It is crazy. But anyway, lockdowns and restrictions in Britain, quote, probably going to get tougher, says Prime Minister Boris Johnson. You can watch that if you want. Here's another one. Dr. Layla McKay, NHS Confederation doctor, confirms to Julia that the hospital's figures for COVID patients include patients who are not being treated for COVID but have simply tested positive while being treated for something else. Yesterday, I showed you Ivor Cummins data that showed all three of the metrics going up at the same time, and he said the only way this data can possibly happen is if they're testing patients who are actually in the hospital to inflate the hospital numbers. That's the only explanation for this data looking like this. And he's right. He's right. So isn't that crazy, right? Like, this is not conspiracy theory. The math, sometimes numbers just tell their own story. Sometimes the conclusion is blah. Like if you've cut something too short, you don't have to explain it to somebody. And if they say, what do you mean? Like, you point to the shelf and go like this on the thing that was supposed to hit on the other side, right? And then they understand, oh, right, it speaks for itself. You don't have to explain it. It's obvious, right? So it's problematic when the obvious data is not being acted upon. My politicians being the people who represent me in Guelph, don't seem to care that there's only 3 people in the hospital. Lock your business down. There's danger afoot. Now, another person has died, but there were 6 people in the hospital the other day on the 3rd, and they didn't, I guess they didn't update 4th or 5th. I don't know. I'm not sure. Oh, this is the 4th, right? So 3rd, 4th. So 1 died and 2 were discharged. Death is always tragic, but this is not a number to lock our whole city down for. This is not a number to lock down our province for. What is going on? I know what's going on. Here's Patty Haydu, the Health Minister of Canada, at a crisis time when they're talking about locking down entire provinces because of the dangers of COVID-19. Patty Haydu tweets out 16 hours ago, we're making sure that big polluters pay the price and passing those savings on to Canadians this year. An Ontario family of 4 can expect a $600 rebate and over $2,000 by 2030. They're implementing, this is the carbon tax that they're implementing. This is the increase in the carbon tax. Carbon tax makes it more expensive to, well, hold on. Dan McTeague outlines it a bit better. Hold on. This is what the carbon tax will do to food prices. Forget just the transportation and the increase in gas. Forget it. Okay, here's Alberta. He says, farmer paying $22,000 in CT carbon tax for 1 month of grain drying. Maybe people will wake up when bread is $15 a loaf, Cheerios $20 a box, pasta $15, beer $100 a case, rye $100 a 26er. By then it'll be too late. Wake up, Canada. These very people that feed us, and they can't afford Justin Trudeau's carbon tax. And Dan McTeague says, this is only the beginning. Carbon taxes on those Canadian farmers will rise 4 times in 9 years. Most can't pass that on while international suppliers will have an unfair economic advantage. Meaning, if you can sell Cheerios at 99 cents, they're not going to buy the Canadian Cheerios anymore, right? They're not going to buy the Canadian wheat. They're not going to have their manufacturing plants here at all. They're not going to buy our product because they won't be able to afford it, because the carbon taxes are, it's punitive. They'll shut down because you can't. It doesn't make it financially feasible. Trudeau and the Liberals and their ally and in the NDP, Green and Bloc are set to destroy the energy, ag, and MFG sectors. Here's another tweet. Had a few DMs with Ontario and prairie grain farmers. If carbon taxes for drying grain at $20 a ton represents 1/5 of the total cost, Trudeau's green carbon scam will raise that 8.5 times, not including similar rise in freight charges. Are Canadians okay with destroying Canada's AG sector? Yeah, that's what's happening. That's what's happening in real time. And how do you stop it? Make some noise. That's it. So I didn't mean to get waylaid there, but I think that fit better there. So back to COVID stuff. You can enter Canada without having to prove that you're not a murderer, rapist, or drug dealer. Yet, if you can't prove that you've had a COVID-19 test, the government will lock you up in a federal facility. Great, wonderful, right? You'll be warm. There'll be Wi-Fi. I don't know if there'll be Wi-Fi. I doubt there'll be Wi-Fi. An Ontario commission investigating COVID spread in long-term care homes says the government is unresponsive to data requests. Shocker, because the data doesn't back up what they're doing. Dan Kelly says, well, he's promoting Anthony Furey's column. Many businesses are quietly bending the rules. Who can blame them? Bending the rules, right? If you're Adam Skelly, though. Right, if you open your barbecue. I asked Dan, when will you either support a lawsuit or full civil disobedience? What emergency are they citing? What metrics are they using to classify this emergency? Do you know? I don't even know. At what point is this emergency over? When do we know the emergency's over? When there's 3 people in the hospital, right? When can we breathe a sigh of relief? When can we celebrate the positives? When can we, I should stop talking because the brown shirts are going to show up, right? Like, oh my goodness. I keep maybe miscasting the bad guys. Sorry, and I lost my place. Hold on. The enforcement arm of the communists is who I mean. The bad people who are just following orders, comrade, right? Those are the people that I'm talking about. They'll show up and make sure that I start in with the right think and new speak, right? Anyway, politicians flying to visit sick relatives. Canadians have been barred from visiting parents and grandparents in long-term care homes in Canada for months, even denied permission to be with them, holding their hands while they died. Yeah, it's very interesting. I thought this meme was good. Breaking news, Canadian government urges you to avoid travel so you don't bump into them while traveling. Yeah, you don't want to accidentally run into Justin Trudeau. Here's another travel-related one. Can you please explain to WestJet, can you please explain to your customers why it's dangerous to have food service in economy but not in premium? I find it incredibly disconcerting that on a 4.5-hour flight from YYC to PVR, those in economy were not offered food or drink service, but those in premium have full bar and food service. Please explain your rationale. I'll be sharing this widely. Yes. So, I mean, it's safe. It's safe for the richer people to have food service, but you guys back in coach, I'm going to close the curtain now, right? We don't need to do that. So customer service is taking a nosedive. This I found interesting. We're going to get into masking here for a few tabs. Here's a study out of Germany, I believe. It says masks harm children. And here's the quick abstract. Basically, there's a registry that's been set up at the University of Witten, Herkedek. Sorry if I've got that wrong, where parents, doctors, and others can enter observations. On 2010-2020, 363 doctors were asked to make entries and to make parents and teachers aware of the registry. By 26-10-20, their registry had been used by 20,353 people. In this publication, we report the results from the parents who entered data on a total of 25,930 children. The average wearing time of the mask was 270 minutes per day. Impairments caused by wearing the mask were reported by 68% of the parents. These included irritability, headache, difficulty concentrating, less happiness, reluctance to go to school or kindergarten, malaise, impaired learning, and drowsiness or fatigue. This is, very concerning, and I'm glad that somebody's doing some research on it. So there's the link if you want to check that out. It's in a tweet thread. So when it brings you to this one, just scroll down. Sometimes that happened to me actually. I didn't mean to talk about I meant to start the show with this link. This was just extra. So anyways, moving on, masks harm children. Yes, here's another one. This is a long thread of different, dentists talking about the failures or the explosion of gum disease, peer-reviewed studies of impede normal O2 exchange, blah, blah, blah. This is just a long thread compiling a bunch of different mask problems that are cropping up that are not exactly being ignored, but they're not being reported on, right? It's like fear, 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 COVID-19, COVID-19, don't worry about gum disease, right? Here's the travel, and this is a distraction story, right? Tim Houston said we should expect our elected officials to walk the walk, not just talk the talk. And he's threatening to fire any caucus colleagues that have left the country, right? And same with Jason Kenney. He's releasing his statement. Albertans have every right to expect people in positions of public trust to be held to a higher standard of conduct during COVID-19. Over the weekend, I've listened to Albertans who are sending clear messages that they want real consequences for these actions. My statement. So he's fired a bunch of different people and moved people from positions and blah, 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 blah. Here's one I thought was funny. Conservative Senate leader Don Plett took a brief personal trip to Mexico. He got there on like the 28th, and then on the 31st, he was like, this is not very good, and came back. I don't know. Does he want a prize or something, right? Allard resigns. She was one of the first, and it was one of those things that Jason Kenney was not, they weren't holding it up, I suppose, but it was one of those things that was being held over him, saying, well, I mean, she violated all the rules and she should be removed. So now she's removed. Now she's gone. The WHO, this was back in March, says you should not wear a mask if you don't have respiratory symptoms. Otherwise, masks are a risky infection vector. And here's a video and here's a tweet from the World Health Organization. Blue check mark, right? And they say if you don't have any respiratory symptoms such as fever, cough, or runny nose, you don't need to wear a medical mask. When used alone, masks can give you a false feeling of protection and can even be a source of infection when not correctly used. And when's the last time you've seen masks correctly used? Oh, that wasn't supposed to be there. Anyway, darn it. Ezra says, back to the traveling politicians. I can't see how Premier Scott Moe doesn't fire his lockdown cheater after this. Hargrave went to Palm Springs over Christmas, and his alibi is falling apart under scrutiny. I think he'll be sacked by tomorrow. All of this is a distraction. I made this note so I wouldn't forget to talk about the distraction. All of this is not talking about the loss of our civil liberties. All of this is not talking about the police who are acting like communist enforcers. All of this is not talking about the politicians who are ignoring the data and the treatments that are available to a lot of people if they want to try them. They're not healthy drugs. They're tested drugs. They're drugs that aren't vaccines, and they've been used for other things for a lot of years by humans. So why are we not allowed to even have those discussions? And why is Ezra being so gotcha about this, right? Like this is a story in that they're not following their own rules. So that's fine. I don't want them to now follow their own rules because all they'll do is hide it better, right? They're just not going to post publicly on Twitter anymore and hope they don't get caught. But all I want from this is not for them to be shamed into following the rules that they've created. I want them to be shamed into removing the rules, into admitting the fact that this was absolutely failed. It didn't work. It didn't work to stop any kind of spread of COVID-19. And really, the problem is we should probably look and see if the tests that we're doing do have the high false positives. And then we should start testing asymptomatic close contacts. We should start testing the close contacts of healthy positives to find out if asymptomatic spread is actually anything to be worried about. Because as soon as we know that, there's no need to continue with masks or social distancing or any of the other unbelievably communist, draconian measures that we've tried to use to get this under control. And what they're saying, like I said at the beginning of the show, what they're saying is without these measures, it would have been so much worse, despite the fact that they have absolutely no data to back that up other than models. The models are what they're using to say it would have been worse. It's not appropriate, right? And all of this travel garbage is just a distraction. It's the flavor of the week. It feels like a good sticky story, right? Oh, those hypocritical rule breakers, right? Let's not use it. Let's not use it to shame them, to get them to be further locked down and lose their jobs. Sure, if they want to fire them because they're hypocritical, that's fine. But let's use this to push the fact that we want our civil liberties back, for crying out loud, right? Like this isn't about fire them. This is about unlock the lockdown. It's clearly nuh-uh. And if these people, I've heard a rumor that these people are not on board. This is the big clean out of the people who don't want to do this big reset, this whole International Monetary Fund, the purchase by the government of all the housing and all that stuff. This is the clean out of that group. That's what I hear. So I don't know if that's true. I have no idea. But the reality of this is, if that's true, come and talk to me. Come and talk to me. I'll blur your face. We can have a private meeting. You can prove to me who you are and nobody else, and we'll chat on the record, off the record, right? We won't tell who you are. Honestly, come and talk, because the only way this even has an inkling of the ability to stop it is if we can actually talk about it. But at this point in time, I have no idea. I have no idea what's going on, but it seems like nobody seems to care about the massive amounts of debt we're getting into. Nobody seems to care, including Ezra Levant, about the loss of civil liberties that we're losing. He's more interested in chasing down the hypocritical rule breakers. So, man, use it for something else. Jeepers creepers. I called public health. People were asking about this. So, yeah, I'm on this still. They only opened yesterday. I called them because I went looking on the website for their policies and procedures, and it says, our policies and procedures are available upon request. Ha, your tax dollars at work. Is this acceptable, Christine Elliott? Really? Really? You have to call in for the policies and procedures? I called in. I talked to the receptionist. She's very nice. So it says, I called in to find out about the social media policies. Did you know that their policies aren't posted on the website? You have to call in and ask for them. I mean, do they send it in an email? Huh. Be interested to see. We'll find out, I guess. But it's very, very interesting. They're allowed to block people, I guess, according to their not posted policies. Ha! It's farcical, except it's not, right? It's farcical, except it's not. I don't know what to think about this. I heard conflicting rumors. I just bookmarked it to look into it. I heard this morning when I got up that Julian Assange's bail was not confirmed. So this tweet says confirmed that bail has been granted for Assange. He should be released in the past 48 hours. And then I heard that he hadn't been granted bail. And then I heard that he's actually already been released and somebody had court documents that looked legitimate, but I don't know how to vet such things. Like it looked real enough to me, but at the same time, who knows? So I don't know what's happening with Julian Assange. I don't know. It seems like interesting timing, doesn't it? The Mexican Prime Minister yesterday offered asylum for Julian Assange, which is also interesting timing. Here's reference for that. So I don't know. I don't know what's happening. I don't know what's happening at all. It's very interesting timing, right? The timing of all of this. I think that there's a piece of this puzzle that is playing out in the United States that Julian Assange is meant to play a role in. And I know that Trump has, and the president of Mexico are if not close, able to do a deal like the USMCA. So that's interesting, watching all of those dealings in context with this dealing. What's going to happen next? I don't know. I still think we got to watch and find out. We had a rally last night, Trump did, and that seemed he didn't look like a guy who was desperate. He didn't. I didn't watch it all, but he didn't look like a guy who was desperate. I watched some of the highlights of the Trump rallies, right? And he didn't look like a guy who was scrambling. He didn't look like a guy who was pleading his case. He didn't look like a guy who was even actually worried at all. Which, hey, great. That's what you need, right? Like, I guess if you've been in the high stakes world of Manhattan real estate, the freedom of the free world and the continuing existence of the United States as we know it. Biden said he's going to pack the court. Biden said they're going to look at increasing senators, I guess, or I can't remember which one he said, congressmen or senators. The one with the fewer members, right? There's one house that's got 2 members from each state, and there's one house that's got population representation, but he wanted to stack the one that only had 2 members and then increase the number of states to cut up California into some states. I don't know. But really, he didn't look worried. He didn't look worried at all. So here we go. We're all in this together, right? We're all in this together. Thanks for watching, everyone. Check out CanadaPoly.com. Check out CanadaReport.co. Don't fall for the distraction. It's a candy popcorn story that is not the real story. The real story is the loss of our civil liberties. That's going to be the title of the video. Thanks for watching, everyone. Have a wonderful, wonderful day.